Good afternoon. Do any of you put sunblock on every day or at least most days? Well, in the moments to come, my goal is to inform you on what skin cancer is. This is to help you gain some useful info knowledge on what skin cancer is, how to prevent yourself, and why it's important to check yourself regularly. My knowledge not only comes from my personal experience with skin cancer, but also from the research I've done since then to make myself more aware. First, I'm going to talk about what skin cancer is and the 3 different types. Second, I'm going to talk about some different treatment options there are if you ever develop skin cancer yourself. And third, I'm going to talk to you about some useful tips on how to prevent skin cancer. Now I'm going to explain to you what skin cancer is. Skin cancer is actually the most common type of cancer diagnosed. It usually forms in skin exposed to sunlight, but it can actually occur in any parts of your skin. Our skin has several layers. Skin cancer actually occurs in the outermost layer called the epidermis. In this area, there are basal cells, squamous cells, and melanchoite cells. These cells are the ones that actually turn cancerous. So now let's talk about these 3 different types of cells. Skin cancers include melanoma, basal cell, and squamous cells. Basal cell and squamous cells are the most common types, and treatment is very effective. These cancers are often found in areas exposed to sunlight, but they can still occur anywhere on the body, such as the head, arms, neck, and chest. Melanoma is a less common type of skin cancer and is difficult to treat unless you have an early diagnosis, then treatment is very effective. Melanomas are usually black, brown, but can also be seen in pink, white, or even tan, or even purple. According to Vestergaard, in the case of the diagnosis of melanoma, the use of dermoscopy provides more accurate results when using the clinical evaluation alone, better than the naked eye. Potential signs and symptoms of melanoma and even other types of skin cancer can be identified with the ABCD rule. Into account during the taking into account into the examination. This stands for asymmetry, border, and color dermoscopic features. Secondly, let's talk about how skin cancer can be treated. Skin cancer treatment can include either medication, surgery, and or radiation therapy. Medications can be taken orally or just topically. Some are meant to cause the skin to dry up and fall off, while in oral medications it actually attacks it from the inside. One medication described by the Skin Cancer Foundation is called dabrafenib. This oral medication controls the defective gene BRAF. This is in charge of cell growth. While most of us know that radiation therapy is used to fight cancer cells is about the same in most cancers, surgery for skin cancer is different. After a biopsy is done in the suspected area, there's about a week time till the results come in. If it is unfortunate in the case where it actually comes back positive, then they will take you into surgery, and what they will do is actually perform an excisional surgery. So in this surgery, what they'll do is they will cut around the suspected area in a circle. After that, you'll be waiting, and while they test the cells. If they find any cells on the outside of the border that still contain cancer cells, then you'll go back into surgery and they'll cut you around again. This will be the border. Surgery like this will continue until they either find that the cells no longer appear in the border surrounding the area that was first affected, or until they decide that a different treatment option is better. Lastly, here are some suggestions on how you can prevent skin cancer. There are some obvious ones, of course, to where you just wear covered clothing, such as like a long sleeve t-shirt, pants, and a hat. But of course, they don't have to be thick as long as they just cover your skin. However, most of us, when we talk about skin protection, we think about sunblock. So when it comes to sunblock, you can actually just buy SPF 30. While most people think that buying SPF 100 is the best option, SPF 30 lasts 2 hours, and anything more than that only adds a few extra minutes to your lasting time. In a research article done by Sang Park, a study was actually found that the use of vitamin D was an effective way in helping someone prevent the risk of developing skin cancer. Although you go out of your way to protect yourself every day, in some cases like mine, skin cancer cannot often develop due to just genetics, so checking all parts of your body regularly is important. To conclude my speech, I would like to remind you that first I explained to you what skin cancer is in the 3 different types. Second, I told you about some different treatment options that there are. And last, I told you about some ways to prevent yourself from developing skin cancer. Now I'd like to leave you with this last note. The important thing is to trust your instincts. In my case, I trusted my instincts, and that's how I found out that I had it, instead of trusting my mom, who was not a doctor and decided that it was okay. But because I went on my instincts, I was able to stop my skin cancer early on. Thank you.